Good afternoon, everyone. Thank you for joining us today. We're here to talk about a very important topic, periodontitis and dental bone loss. You might also know it as gum disease. It's a condition that affects many people, often without them realizing it in the early stages. Today, our goal is to help you understand what periodontitis is, why it's so important to address, how we diagnose it, and most importantly, what modern treatments are available to help you achieve and maintain lasting oral health. We'll break down complex information into easy-to-understand parts, so please feel free to ask questions as we go or at the end. Let's start with a foundational concept, dental bone loss. This isn't just about a sensitive tooth, it refers to the loss or deterioration of the jawbone that holds your teeth firmly in place. Imagine your teeth are like trees, and the bone is the soil. If the soil erodes, the tree becomes unstable. When we see dental bone loss, especially alongside persistent bad breath, it's a strong indicator of a serious condition called periodontitis, which is an advanced form of gum disease. If left untreated, this bone loss can cause your teeth to become loose, shift positions, and eventually, you could even lose them. It's a silent process in its early stages, which is why regular dental checkups are so crucial. Now, let's define periodontitis. It's not just a simple gum inflammation like gingivitis, which is reversible. Periodontitis is a chronic, ongoing inflammatory disease that begins when bacteria and plaque build up below your gum line. These bacteria then trigger your body's immune system. While your body tries to fight the infection, this prolonged inflammatory response, unfortunately, starts to destroy the soft tissues and, critically, the very bone that supports your teeth. As this destruction occurs, the gums pull away from the teeth, forming deep spaces we call pockets. These pockets become perfect breeding grounds for more bacteria, making them impossible for you to clean at home, leading to a vicious cycle. It's vital to understand that periodontitis doesn't just stay in your mouth. The bacteria and the inflammation from your gums can enter your bloodstream and affect your entire body. In terms of your oral health, it can lead to tooth loss, teeth shifting, increased sensitivity, and painful infections called abscesses. But the impact goes far beyond your mouth. Research has established strong links between periodontitis and serious systemic conditions. For example, it's associated with an increased risk of heart disease and stroke. There's a significant two-way relationship with diabetes. If you have periodontitis, it's harder to control your blood sugar, and if you have uncontrolled diabetes, your gum disease can worsen. It can also contribute to respiratory infections, adverse pregnancy outcomes, and emerging links suggest connections to kidney disease, rheumatoid arthritis, and even cognitive decline. This really underscores why managing your periodontal health is so important for your overall well-being. So, what primarily causes this bone loss in periodontitis? The absolute main culprit is bacterial plaque and its hardened form, tartar, also known as biofilms. These are sticky, organized communities of harmful bacteria that cling to your teeth. They produce toxins that trigger your body's immune response. It's this continuous battle between your body and these bacteria that unfortunately results in the destruction of the bone. While these biofilms are the direct cause, several factors can contribute to their growth and make you more susceptible to periodontitis. These include poor oral hygiene, smoking or tobacco use, which significantly worsen the disease, genetics, systemic health conditions like diabetes, certain medications, and even stress. It's a combination of these factors that determines how the disease progresses. Periodontitis often starts silently, so recognizing the symptoms as it advances is key. One of the most common and telltale signs is persistent bad breath, or halitosis, caused by the odor-producing bacteria in those deep pockets. You might also notice your gums are red, swollen, tender to the touch, or they bleed easily when you brush or floss. Your gums might also start to pull away or recede from your teeth, making your teeth appear longer. As the bone support weakens, your teeth might become loose or start to shift, creating new spaces. You might even notice pus coming from between your teeth and gums. Other signs include difficulty chewing, changes in how your teeth fit together when you bite, discomfort with dentures, or even jaw pain. If you experience any of these symptoms, it's crucial to see a dental professional right away. Diagnosing periodontitis accurately requires a thorough examination by your dentist or a gum specialist, called a periodontist. We start by reviewing your medical and dental history to understand any contributing factors. Then, we do a visual exam to look for signs like red or swollen gums. The most critical part of the exam is periodontal probing. This involves gently measuring the space between your tooth and gum. In a healthy mouth, this pocket is typically 3 mm or less. Deeper pockets indicate bone loss and an active infection, as they're impossible for you to clean effectively. We also take dental X-rays to see the bone levels around your teeth and identify any areas of bone loss. We check for any tooth mobility, meaning if your teeth are loose, and assess for bleeding when we gently probe your gums, as bleeding is a direct sign of active inflammation caused by bacteria. When it comes to treating periodontitis, our goal is multifaceted. We want to control the infection, stop any further bone loss, and, where possible, help regenerate lost tissue. Because periodontitis can range from mild to severe, your specific treatment plan will always be tailored to your individual needs. We typically follow a phased approach, meaning we start with the least invasive methods first, and then move to more advanced options only if necessary. The initial phase of treatment involves non-surgical approaches. The absolute foundation is oral hygiene instruction. We'll teach you effective brushing, flossing, and how to use special tools to meticulously clean between your teeth and below your gum line. Next is scaling and root planing, or SRP, often called a deep cleaning. This is done under local anesthesia to ensure your comfort. During SRP, we thoroughly remove all plaque and hardened tartar, called calculus, from both above and below your gum line. We then smooth the root surfaces to make it harder for new bacteria to attach. In some cases, to boost the effects of this mechanical cleaning, we might use adjunctive antibiotic therapy. This isn't a standalone treatment, but a supplement. We might place a topical antibiotic directly into a deep pocket, or, for more aggressive cases or widespread infection, prescribe a short course of oral antibiotics. This combination helps fight bacteria that mechanical cleaning might not reach entirely. If, after non-surgical treatments, some deep pockets or bone defects persist, we might recommend surgical options, usually performed by a specialized gum dentist called a periodontist. Don't worry, we have various sedation options to keep you comfortable. One common procedure is flap surgery, also known as osseous surgery. This involves gently lifting the gum tissue to get direct access to meticulously clean the root surfaces and, importantly, to reshape any irregular bone around the teeth. These irregularities can act as bacterial traps that you can't clean effectively. By reshaping the bone, we create a shallower, healthier environment. Other surgical options include soft tissue grafts to cover exposed roots and reduce sensitivity, and bone grafting or guided tissue regeneration to rebuild lost bone and help new tissue grow. And, if a tooth can't be saved, dental implants are an excellent option to replace missing teeth and help preserve the surrounding bone. This is a common and important question: why might surgery be recommended if antibiotics can fight bacteria? The main reason is that periodontitis isn't just a simple bacterial infection that a pill can always cure. The bacteria live in highly organized, sticky communities called biofilms. The plaque and hardened tartar. These biofilms are incredibly resistant to antibiotics. More importantly, antibiotics cannot physically remove the hardened tartar or reshape the irregular bone defects that act as bacterial traps. And while antibiotics can temporarily reduce bacteria, they don't physically eliminate the deep pockets themselves. As long as those deep, uncleanable pockets exist, bacteria will inevitably return, and the disease will recur. Osseous surgery directly addresses these physical issues by thoroughly cleaning and reshaping the bone, creating a healthy, maintainable environment. Antibiotics are very valuable as adjuncts, meaning they assist mechanical therapy, but they can't be the sole solution for established bone loss. We always follow a phased approach. We begin with the initial therapy, which is your excellent home care combined with professional scaling and root planing. The goal here is to drastically reduce the initial bacterial load and inflammation, giving your gums a chance to heal and tighten naturally. After this first phase, usually around 4 to 8 weeks later, we perform a crucial reevaluation. We remeasure your pockets and check for bleeding. This allows us to see exactly which areas have responded well to the deep cleaning and are now healthy and maintainable. And importantly, it helps us identify which specific pockets truly remain deep and problematic, despite our best non-surgical efforts. Only at this stage, for those persistent, unmanageable areas, do we then consider if further, more targeted treatments like surgery are genuinely necessary. This ensures that surgery is only recommended when it's the right next step to get your gums truly healthy. When performed on suitable cases and followed with diligent home care and maintenance, periodontal surgery is considered highly effective and predictable. We often see significant reductions in pocket depth, with 90 to 95% of treated areas becoming shallow and maintainable, typically 3 mm or less. The most important long-term success is tooth retention. Studies show that patients who undergo surgery and consistently follow their maintenance program have very high rates of keeping their teeth for 10, 20 years or even longer. As with any surgery, there can be common post-surgical effects like temporary tooth sensitivity, some mild gum recession which is expected as pockets shrink, and temporary discomfort or swelling. Less common complications might include persistent infection or continued bone loss if the disease isn't controlled afterwards, or root decay due to exposed surfaces. While the primary goal of osseous surgery is to create a healthier foundation, you might be concerned about gum recession, which can expose tooth roots and cause sensitivity. The good news is that modern periodontal plastic surgery offers highly effective solutions to address lost gum tissue. These are separate procedures designed to either add new gum tissue through grafting, often from your own palate or using donor tissue, or to move existing gum tissue to cover exposed roots. These procedures have very high success rates, often achieving 85% to 98% root coverage, which significantly improves aesthetics, reduces sensitivity, and protects your teeth from further damage. This is arguably the most critical slide. Periodontitis is a chronic disease, much like diabetes or high blood pressure. While our treatments can control it, the underlying susceptibility and the presence of bacteria mean it can recur if not consistently managed. That's why long-term periodontal maintenance is absolutely crucial for the success of your treatment. Harmful bacteria can regrow to destructive levels in your pockets within about 9 to 11 weeks, roughly 3 months, after a professional cleaning. So, for most patients who have had periodontitis, these maintenance visits are typically recommended every 3 months to disrupt this cycle before new damage occurs. This is generally considered a lifelong commitment to protect your investment in treatment and preserve your natural teeth. During these visits, we perform a more extensive cleaning than a routine checkup, remeasure your pocket depths, and reinforce your home care techniques. To summarize, remember these key points. Periodontitis is a complex, chronic disease that causes dental bone loss and affects not just your mouth, but your entire body. Early diagnosis and a comprehensive, multi-phase treatment approach are crucial for managing it. We always start with non-surgical deep cleanings, and only consider surgery for those areas that remain problematic. But most importantly, your diligent home care and consistent, lifelong periodontal maintenance appointments are the backbone of lasting oral health. If you have any concerns or haven't had a recent evaluation, your next step is to schedule a comprehensive periodontal evaluation with your dentist or a periodontist. We're here to help you on your journey toward a healthy smile.